Hello, everybody, and thank you for inviting me along with this get together. And I really hope it will be a get together rather than just, a talk from me. Thank you, Stephen, for making me feel very welcome. It's actually quite daunting listening to what you've all said in the introductions to provide you with the hints and the tips that you so clearly want. And I think that's very telling that must be echoed, time and time again with every person trying to access GP surgery. So let me give you a little bit of a background about me, and then maybe talk you through how the appointments are made and run in the surgeries I've worked in, and then maybe together we can try and get some ideas as to how to improve it or make it simpler or easier for us moving forward. So I qualified as a doctor over 20 years ago. I've worked in hospitals. I've taken calls from GPs desperate to get their patients into the hospital to be seen by the emergency services. I've answered the bleeps and had the screaming from them, their end, saying, please, I've been a GP for 20 years. Let me, refer this patient. I know better. I've then become a GP myself and seen it from that side of the fence. And more recently, I was a GP partner in quite a big surgery. So I was, one of the bosses. I was involved in trying to make things better. We introduced a new telephone system way before COVID into our practice with 12 lines, which was meant to make access a bit easier. But all the lines were immediately filled. We still had waits up to an hour quite regularly for people to try and get an appointment. More recently, again, I'm now a salaried GP. That means that I'm not one of the partners. I am employed by the GP practice, and I do a lot more in this mental health role. So I advise the CCG about mental health topics and do that in Hertfordshire. So that's my kind of background. In terms of appointments, I'm also a patient. I'm a daughter, mother, and my father, and my parents-in-law need appointments, and I try and help them to navigate the system. I'm a mother. One of my children has needed a lot of medical care, try and navigate the system for them. And also I use GPs myself. We all have to have our own GP. So we do see it from the other side of the fence, and it's tricky. You're on the phone, as I know, for up to an hour, and then you get cut off. Or you're on the phone, you get through and they say, all the appointments are finished for today. And no amounts of yeah, but, and please, but really it's important, can change that fact. The appointments have run out, they're finite. And I think that's what's so disappointing and so sad. Some things have changed a lot over the last 20 years, and some things haven't changed at all. And there are still not enough appointments. We're still at capacity and more. And those who shout loudest win. Those who shout loudest get, and that's not fair. I was reading some statistics that 10% of our population on our books take up more than 50% of the appointments. So then I thought about that and I thought, well, that's probably maybe quite right, because they're the 10% most unwell. They're the people who really do need to see the doctor twice a week. But maybe that's not right. Maybe they're the ones who are using the doctor as a crutch, or the GP as a crutch, and actually there should be other services in place for them, so that other people who don't shout loudly or can't use the telephone or can't email the surgery can access the medical and mental health appointments that they need. So just to tell you what has been changing on a more positive note over the last particularly 3 or 4 years, we've been following the NHS ambition to enhance primary care mental health. So that means making sure that people's mental health is acknowledged and as important as their physical health, that everybody has mental health, and it's when you have mental ill health that you need help, and we all deserve to have access to services for that. The NHS ought to provide it and ought to be in partnership with and collaboration with the county council, voluntary sector, carers, users. All of us together, the community, need to support our own mental health. And at different points on that pathway, or that zip wire, as it were, from what we call mild mental ill health, a bit of stress or a bit of worry, right the way through to needing intensive care admission where you have ECT for depression. All along that zip wire, a person who needs help with their mental health needs to be able to get it quite quickly and with the most appropriate service. And I think we're all on the same page, finally, which is just great news. It used to be relatively recently that I would attend meetings and talk about mental health, and half the meeting would literally switch off their computer, either switch off mentally back in the day when we met up, or switch off their computer. That doesn't happen now. Things have changed, attitude has changed, and that's all credit to everybody who's talking loudly. Agencies like Viewpoint, who are giving the view and giving the platform to enhance the prevalence of awareness of mental ill health. So, pat on the back to you guys, and pat on the back to people like you. But that said, we do need to perhaps push it further, because I believe that people with mental ill health might find it even harder to navigate the service than somebody with a tummy ache or somebody with a headache. So you need to see the doctor, you need an appointment, and you are all on the telephone waiting and waiting and waiting, and then speaking to the receptionist and then getting that appointment. But I would argue that somebody with mental ill health also then perhaps has to see the right person for them, has to have the appointment at the right time for them, because it might provoke further illness and further symptoms unless they can have a bit more control of that encounter. But then trying to fit that demand into the already overstretched GP appointment system is impossible and fails. And that's why we have so much disgruntlement, and that's why we have so many disasters. And I'm sure you'll all have stories about failing to get an appropriate appointment and how frustrating and upsetting that is. And I think, we hear you. I would like to get across today the fact that we do hear you. I think GPs do realise that people on the other end of the phone have been through an obstacle course to even get there. Back in the day, I worked in a GP practice where people walked in for an appointment. They didn't make an appointment on the phone or in person. They just queued, and they would queue around the block. And by lunchtime, we'd have got through every single person in that queue. We are so far from that now. It's like living on a different universe, isn't it? We now have email appointments. We have telephone appointments. We have video appointments. We have text messages going backwards and forwards. And some of that is really, really good. It's brilliant. You talk to your city worker who doesn't want to come in. You talk to your mother with 3 kids under 5 who really can't get on the bus and come in to see you for molluscum. They just want to send you a photo and get a quick prescription, and they're done. And we are using that technology. And if it wasn't for COVID, we wouldn't have pushed it as quickly and as effectively as we have. So there's some positive things. But I think what we have to do is to accept that that's not the panacea. That's not the tablet. That's not the cure for GP access and GP appointments. It's just one way of working smarter. And there are many, many more who will need and deserve and should have face-to-face appointments with enough time, 20 minutes, 30 minutes, with the right people in the room. And it could not just be the GP, it could be the GP and then primary care mental health worker and the social prescriber and the social worker and the drugs and alcohol worker, all around one multidisciplinary team meeting to help that one person. And that's our ambition, our aim, our view towards the future. And when we talk about transitioning mental health into the community, it's based less on the GP, not because the GP can't be bothered, but based less on the GP as the cure-all, and more on the GP as part of a really well-oiled multidisciplinary team where we all work together and we all respect each other and we all help in our special areas to enable the person with the mental ill health to get the help they need. And then finally, before we go to Q&A, the other thing that we've been pushing for and really getting more and more successful in is the attitude that mental ill health or mental health should be considered at every contact, every single appointment. And I think we're finally getting through that, it's really important. Somebody may well come in with a heart attack or having had a stroke, but unless we consider their mental wellness, they're not going to recover as holistically and as well as somebody who just gets given a tablet and told to exercise. So I think mental wellness, mental well-being is becoming much more normal and much more acceptable to bring up in an appointment. And then obviously looking at our people who suffer with serious mental illness. And by that, we kind of shouldn't put them in a box, but we put in a box, for example, bipolar affective disorder, schizophrenia, people who need medication possibly to stay well, people who would need the input of a psychiatrist. We need to free up some of our current mental health appointments and current mental health contacts for people with SMI. And we need to provide more for those who are using those appointments in a more appropriate manner, be that peer support or cognitive behavioural therapy, wellbeing therapy, New Leaf College, etc. So I think it's a combination of all of that, which will then help to release some of the GP appointments that are needed for mental illness.